Hi everyone, so welcome to the Clinical Pharmacist Documentation tool. So in this tutorial we will go through how to use this new BPMH BPMDL database. Our previous database has been split into two to increase efficiency. So the login screen is the same, so just log in using your last name. And the home screen has changed slightly, but it's basically the same. So here you can see the BPMH, so you can add a new patient if you'd like. You want to just enter MRN, PHN just like before. And then click to add a new encounter for your patient. So here you can see that the screen is a little different. It will show the pharmacists that have been involved with this patient right here. So if multiple pharmacists are involved with the patient's medications, they will have both of their names populating in this column. Here you can see the same as before. You could put the date the patient was admitted, what they were admitted with, the date you were reconciling the medications, what community pharmacy they go to, and again, this adherence assessment is the same as before, so this patient uses vials, manages their medications on their own, picks up their medications, and we have no compliance concerns. Again, we have this box with pharmacist notes only. This information will not print on any of the reports. It's purely for the pharmacist to see. And at the top you can see we have the admission BPMH tab, the same as before. So you would enter in all of their medications that they were taking prior to admission here. So we'll just do a very simple patient just for an example. Again, everything is the same as before. All of the reports are the same as previous. So we've got med profile, which is your BPMH, a patient medication list if they required a list, the order sheet, and the one for medication reconciliation, and the discharge template or the discharge RX for the doctor. In the essence of time, we won't go through them. I think everyone should be familiar with these reports. Again, the quick view admission list is here as well if you'd like to quickly see what's been entered. So once your BPMH is completed, just click to say, yes, it's been completed. And here you can see a new screen will pop up saying that there's a transfer in progress and the application's busy as it's rolling over an admission to a discharge. So it's important when this screen is up to not be trying to click around in the database, or it could potentially freeze. And here you can see we're now in the discharge BPMDL, and this is where you can create your discharge prescription for a patient. So for simplicity, we'll just use the same patient and make it pretty simple here. We'll just continue their Tylenol, and again, same as before. And all of the reports are the same as before. The fax cover sheets with the ward, phone, and fax built into it, they will auto-populate. The discharge prescription, as we've all seen before, same information as previous, as well as the medication calendar, a patient discharge medication list, and 3 reports for home and community care. So saving and closing and going back to the main screen actually doesn't take you quite back to the main screen yet. You can see this is your patient information here in case you needed to go in and edit a patient. If you wanted to search up a new patient, this is where you could also search. So this doesn't take you back to the initial home screen, but rather back to the patient demographics screen. If you want to go back to the main home screen, save and close again. And here you can search a patient, so click on search a patient. You can search by MRN, PHN, last name, first name, whatever you'd like. And once you've searched a patient, so we'll just search up a test patient. You can see there'll be various test patients here. For instance, test patient Carrie has multiple entries, so you can see all the dates here, so you can pick which date you'd like to go into, and you can go into this encounter. You can click to open it, open this encounter, and you can also add a new encounter for this existing patient. So this is the same as previous. We won't go through this in detail. If you'd like to view your patient BPMHs, you can go here. You can see all the BPMHs you've done for your patients. I think around the most recent 20 will live on your home screen. Under community pharmacies, so this is where you can go into to look at community pharmacies and edit their information. What you would need to do would be click on Find a Pharmacy, find the pharmacy you're looking to edit information on, go into it, click Edit Community Pharmacies here, and then you can edit information. Let's say you found a change in a phone or a fax number. You click the Edit button, you go in and change your information, and then you hit Save and Close. Now make sure that you are confident in the changes you are making, as any changes you make to a community pharmacy will be available to everyone in the island who's using this program, so we need to make sure everything's accurate. If you'd like to add a new community pharmacy, clicking this button right here to add a new community pharmacy, and then entering all of the pertinent details, and then clicking Save and Close, and then that pharmacy will live in our community pharmacy list. If you do have a need for any blank reports, you can get a blank BPMH, a blank discharge prescription, and a blank medication calendar through these buttons here. And when you're done using the program at the end of the day, you just simply click Log Out. So it's basically the same as what we've been using with maybe a few slight changes. Thank you so much.